Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. This week we're talking about PTSD caused by the COVID pandemic and an innovative new therapy to Kansas City. I'm here today with Monty Miller, psychotherapist at St. Luke's. Thank you so much for joining us, Monty.
Thank you, Lindsay. I'm really glad to be here to talk about a very important topic to all of us.
Yes. Well, June is PTSD Awareness Month. After over a year of this pandemic and more than 600,000 deaths due to COVID in the U.S., mental health professionals across the country are seeing patients dealing with PTSD and other delayed trauma responses. Well, Monty, when we talk about PTSD, I think a lot of us think first of military veterans. Who else can experience PTSD?
Well, really any of us can experience PTSD. Anybody who has themselves experienced a traumatic event or have witnessed a traumatic event can experience PTSD.
Okay. And what are you seeing today after the past 15 months of the pandemic?
That's a great question, Lindsay, because we have seen a lot of PTSD in our outpatient clinics. Patients now, we do a lot of virtual sessions, and so a lot of folks who have been isolated and homebound for so long now are fearful of coming out of their home because they still think that maybe they could catch it. They figured out that they can really order everything online, so they're really pretty much staying in their home, and they just really feel nervous about getting out again. So we're doing virtual sessions trying to help them just to take baby steps to get out of their home and feel more comfortable, even if they have to continue to wear a mask.
Sure. And what about those who have lost loved ones?
Yes, we have experienced early on in the pandemic, a lot of folks were not allowed to see their family members or the people they wanted to see in the hospital during the time they were dying or times they were going through severe treatment processes. And so we are experiencing now people who are still talking about the PTSD they have from not being there for their person when they were passing away. And so that's really affected many of them, as well as our healthcare workers. We have really seen PTSD with our frontline workers, and they're talking very much about how it was terrible to and traumatizing to see young people pass away, and young people with children, older people, and just the whole process has been very traumatizing to them.
Right. So everyone's struggling.
Everyone is struggling. And I think they will continue for years after this.
Okay. So what are the symptoms of PTSD, and when is it time to seek help?
Great question, Lindsay, because I think we can be PTSD can be very much misunderstood at times. And really, when we think about PTSD and symptoms, they're kind of grouped into 4 different categories. And so we're looking at intrusive thoughts, where you may have these unwanted thoughts and flashbacks that you don't want to see or you don't want to think about, but they keep coming over and over. Or you might have the avoidance time, where you really try to avoid people and places and things and thoughts. Or we have the negative thinking, and the negative thinking of others, negative thinking of the situation or the event itself. And we have changes in physical and emotional states. So physiologically, you could experience some difficulty. You could experience some depression and anxiety, not sleeping, all kinds of difficulty in those areas. One of those 4 categories. And when you see that it's really affecting your daily functioning, then it's really time to seek help.
Okay, good to know. Well, St. Luke's is the only place in Kansas City now to offer a new innovative therapy to help people deal with trauma. Can you tell me about accelerated resolution therapy?
Yes, I'm very passionate about this therapy. Number one, because it really works and it really helps people in 1 to 5 sessions. So ART, we call it ART, which is accelerated resolution therapy. And it was designed and founded by Lainey Rosenwig, and she's a marriage and family therapist, and she up on the East Coast, and she developed this theory where you can take people through rapid eye movements, a series of rapid eye movements. You have them experience their trauma, their event in their mind, and then you go back and they become the director of the scene, and they can reprocess the scene any way they want to that helps them deal with it better. And it takes away from that emotional and physical reaction like you would in PTSD from the event. And it can help people of all kinds, not just military, anybody who has any PTSD symptoms. And again, it can be treated with folks in 1 to 5 sessions, and they don't have to even talk about the event. They're doing all of this internally, and we're walking them and scripting them through the process.
Okay, great. Well, what kind of results are you seeing with this new therapy?
Amazing results, because I was surprised myself that it works so quickly and so rapidly. And so I've worked with many patients so far where with 1 session, and they're like, at the end of the session, like, oh my goodness, I don't feel the same way I do about that event. In fact, they can't even see the old event without seeing the new event the way they created it. So it's been a very successful treatment here. And I really hope it spreads throughout the community because it's really helpful to everybody, not just severe PTSD, but anybody suffering with a lot of things.
I know there was a couple studies on military veterans and active service military members. Can you tell me about the results that were seen in those in that population?
They're seeing great results. In fact, a lot of this therapy is being kind of treated in veteran hospitals where they're working with veterans. And what's also really great about this particular theory is that the patient does not have to talk about the event, because sometimes they have top secret information that they really can't share as being a veteran. And in this case, in this therapy, they don't have to. And they can still be healed and treated and recover from their traumatic event.
Wow, that's great. Well, what's your final message today to people who may be suffering or struggling with the events of the past year still?
Well, number one is that there is hope, and there is a treatment, and there is freedom that you can have if you get the treatment that you need, and to really take small steps, take baby steps. If you have a hard time getting out of your home because you're struggling with fear of getting sick and COVID, take small steps and wear a mask. I still wear a mask when I go out, when I'm going to be in large crowds, even if it's not required, just because I feel better and I feel safer about that. If that's what it takes for you to get out and start the process of gaining your freedom again, do whatever it takes to seek help to get that.
Thank you so much for joining us today, Monty.
You're so welcome. Thank you for having me today.
If you'd like to find out more about St. Luke's behavioral health, including free webinars on dealing with stress, anxiety, and more, visit stlukeskc.org/behavioral. You can also stay up to date with all the latest developments on the COVID pandemic and other health news from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.